Welcome back, and we're moving into our final segment for today as we learn more about Health City in the Cayman Islands and InterChange Belize Limited, who is their local agent. And we're joined at this time by Regional Sales Manager for Health City Cayman Islands, Hemet Balgobin, and we're joined by Creative Director of McNab Visual Strategies, who is a subsidiary of Health City Cayman Islands, Tanya McNab, and past patient, G. Michael Ried. Good morning and welcome, and thank you for being here.
Good morning.
Thank you.
Yes. Thank you for having us.
And I want to start off just by finding out how this connection got started. Obviously, McNab, locally based, you guys have been working in terms of marketing and different strategies with different companies. How did you make the link with Health City?
Actually, Health City reached out to us about a year and a half ago.
Mm-hmm.
The hospital is how many years old now?
It's going to be 3 years old.
It's going to be 3 years old now.
Mm-hmm.
And so as they were looking to expand in different countries, they started to reach out to find who the local contact could be in each country. And so they found us by referral of a mutual friend in the Cayman Islands. And so we went out there, we visited, we saw the facility, met a lot of doctors there. We were very impressed, and from there we started the relationship as to how Health City could play a role in the healthcare system in Belize and how we can provide services that currently aren't available in our country very easily with Health City in the Cayman Islands.
Okay. Now, let's get a little bit of a backdrop on Health City itself. 3 years old, that's fairly new.
Fairly new.
Yeah. What are some of the services that you offer?
Sure. Well, to start on Health City, and it's fairly new in the Cayman Islands and in this region.
Mm-hmm.
However, it's coming from a system that's well established. Dr. Davy Shetty, who's known as sort of the godfather of cardiology, he owns and operates about 35 facilities in India. And his specialty is in cardiac care. Dr. Shetty was actually Mother Teresa's physician in the last 5 years of her life. And through that, the work that he has done, he partnered with Ascension Health, which is the largest faith-based organization in the U.S. It's a Catholic-based hospital, not-for-profit organization with over 160 hospitals in the U.S. So they teamed up, and they teamed up in the effort to bring low-cost healthcare. Because in the U.S., a CABG or a cardiac bypass, which goes for an average about $150,000 to $200,000 US dollars, Dr. Shetty is offering at $1,400. $1,400 in India. So the objective was to bring that low-cost healthcare system, that model, into the Western Hemisphere and share that. So what best place than the Cayman Islands, which just sits outside of the U.S., you know, to be able to do that. So it's a new hospital in Cayman, but it's coming from a well-established background. Nationally, correct.
Now that's a concept that a lot of people will find difficult to grasp. How do you get specialized cardiac care at such a low cost?
Well, we have the best doctors for one. We have doctors who have done hundreds of thousands of surgeries combined. We're talking about a specialist in the US. If you're sought after, you may do about 3,000, 3,500 surgeries in your career. Our doctors, because of the population and the size in India, they've seen like Dr. Binoy, who's done almost he's almost crossing the 9,000 surgery range. Dr. Ravi Kishore, who's our cardiologist, he's done 15,000. And it's funny because we actually had the benefit managers and stuff from Pepsi-Cola, from Whole Foods and stuff with us just recently. All of these TPAs in the US that do insurance for their companies and do self-pay programs to be able to take care of their employees come. And one of the gentlemen within that group asked Dr. Shetty the question. He was on Skype and he said, well, how many surgeries have you done, Dr. Shetty? He said, well, I stopped counting when I got to 25,000. So it's a vast difference in terms of what we do. Now, that's talking about the quality of care that the doctors can provide. When it comes to the finances and why we're able to have it at such a lower cost, with 35 hospitals in India, with partnering with Ascension in the US with 160 hospitals, we have purchasing power. We're buying everything for a large group of entities, a large group of hospitals. So in everything we do, we negotiate in prices, we negotiate costs of things that we have to buy, everything from the hospital bed to the chairs that we sit on, to medication, to syringes, to lab coats, everything is bought in quantities. So we're able to shift that cost savings and bring that to us, as well as our facility. And Mr. Michael Ried can talk about this.
Yeah.
Although we have a facility that's top notch, we didn't go and spend a lot of money on granite countertops and marble floors. We put in the necessities, the things that you really want to have in a facility to ensure that it's a suitable facility for care.
Yeah.
Our facility is a JCI accredited facility. It was built to JCI standards, and it's only one of 2 facilities in the Caribbean that are JCI accredited. We did it with one of the highest scores ever achieved for JCI accreditation, and that's Joint Commissions US that does that. And we get audited every 2 years, and any new programs that come in, they have to come in and re-establish that.
Well, I can imagine your patient list must be exorbitant. How receptive have not only the locals in Cayman been, and the rest of the region? I can't imagine how
At the cost.
Yeah, especially at that amount.
Absolutely. Well, right now, I was just telling Mr. Michael, because he was there not too long ago, just about 2 months ago,
December, yeah.
right? And the facilities right now is packed.
Full.
We're a 101 bed facility, and so but we're going to become a 2,000 bed facility within the next 10 years. That's the objective. We're expanding. We're currently expanding. We're putting in the residences for nurses, as well as for some long-term patients that have to come and stay longer. We're putting in residences now. We're going to eventually have it's built on a 200-acre sort of footprint. So it's not one hospital. It's multiple hospitals.
It's a city.
It's a city
Correct,
development.
correct.
So it's
just in
good.
the early
Exactly.
stages,
Yeah.
It's still in the early stages with the one hospital built. We're going to start the second hospital fairly soon, which is going to have a lot of, we do oncology, we do cardiac care, orthopedics, we do neuro and spine, we do intervention neurology. There's only a handful of neurologists that do intervention neurology. So for stroke victims, if you get to us within a certain time span, 8 hours, we can actually reverse paralysis or prevent paralysis from occurring from stroke. And there's, like I said, there's only a handful of those surgeons in the world, and we're blessed to have one in the Cayman Islands with us. As a region, we're blessed to have that type of care available in the region.
Yeah.
We get a lot of patients from the Caribbean, as you rightfully said. We get a lot of interest locally from the Cayman Islands, but we're also getting patients as far away from Europe, from South America, from the US, from Canada. We're seeing a significant increase of Canadians and Americans traveling. It's destination healthcare, so people are coming for that. And why not, if you're gonna, have knee surgeries like Mr. Mike, why not be someplace where you can just go and relax on the beach right after you've had surgery and recuperate and have your rehabilitation?
Is that how you recovered?
I don't know about relaxing on the beach.
So, G. Mike, of course, let's get into your personal experience, because nobody can talk about what being in a hospital is like unless you're actually the patient. So you traveled to Cayman for what type of surgery?
Well, first of all, I have rheumatoid arthritis. It's not like I had a bad hip.
Yeah.
So I've had 2 hip operations and a knee replacement, replacing 3 major joints. But one of the hips that I did one hip and a knee in Belize, which went well. And I must say kudos to Dr. Francis Smith, who's an excellent orthopedic surgeon. Then the other hip, I went to Merida, actually on his advice, because he's saying, well, listen, you have one hip that's done with rudimentary type of prosthesis. It's better for you to have the other hip that you have at least one good hip to stand on. Turns out that the hip that they gave me in Merida was identical to the hip that they give in Belize, and it was a shabby operation. So, of course, though, with Merida, Mexico is for Mexicans. So you're not going to go there and sue anybody over any bad surgery. So anyway, Tanya basically got in touch. I was looking for somewhere to get an affordable operation. And it turns out that the people in Cayman were reaching out to people in Belize. And she got in touch with Dr. Smith, who got in touch with me. And the rest, as they say, is history. I went over there, and it's difficult to say that I was in a hospital. It's more like a hotel. It's impeccable, and I hear Mr. Hemet talking about the cutting costs to ensure that they could afford the medical facilities, but they certainly didn't cut any service, and it was impeccable. I mean, everybody from the person, the janitorial people, to the doctors, seemed like everybody were committed to delivering the best possible service.
Tanya, can you talk a little bit about how you make those connections? Because I think for a lot of people, their medical condition, their medical history is very private. And I think even though you need this kind of surgery, it's still something you don't readily share, and you're very I guess, wary about where you go, especially hearing stories like the one that you just shared. How do you make that connection?
Well, first of all, our role is to manage the relationship between our local healthcare professionals and the doctors in Health City, as well as on behalf of the patient as well. So we have met with many doctors here. We are building relations with them so that as soon as a case may arise, with the patient's permission, they refer to our company. We also have a patient care coordinator, Whitney Arguez. She's a registered nurse, and she sort of acts as that private, confidential in between the patient and the doctor. The patient, normally the procedure is we ask for any results, any images, or any information that they have in advance, because we don't want to take somebody to Health City to get there and say, well,
we can't help
you, you're, that sort of stuff. So we liaise between the patient and the doctors. We set up Skype calls very often so that the doctor can consult directly with the patient, so that there are no surprises when they arrive. All the expectations are exactly as we describe them. And so it's a process, because a patient will go where their doctor refers them. And so we are in the process of making
So you
sure
have to get
that
the doctors to buy in.
Correct. And it's more about getting the doctors to have a relationship with Health City.
And that's key. It's a partnership. The thing
Correct.
is that we're not here to change what exists or compete with what exists. What we are is a tertiary care facility that provides specialty surgical
Services, yeah.
services. So if we have, we've had the pleasure of having Dr. Koi, from KPMH, KHMH, sorry, come and visit our facility, and he's referred, patients to us. He's come himself and seen the facility. He's seen our surgical ward. He's met with our doctors. So it's a partnership.
Some of our doctors have also come to visit Belize,
Yeah.
And we've met not only with patients that are being referred from doctors, but also with Yvette Burke through the charitable work that she does. We have taken a baby there that needed.
And we'll talk a bit about that. Yeah,
Yeah.
like that was a cardiac condition.
Correct.
But we also, when we talk about confidentiality of patients, we have HIPAA compliance because of the areas in the countries we work in. All of our systems are HIPAA compliant in how we transfer people's medical records and histories. So those things are very important to us. And again, because of the doctor-to-doctor relationship, because of the assistance and having those meetings in country with the physicians, with the surgeons, we're able to build that relationship and that partnership, and we're there to support them. We're happy to have them come, and a part of the mission of Health City is to create, your guests that were on just prior talked about infectious controls, talked about building capacity. That is exactly what we're doing. We have transplanted a system from India, brought it into the Western Hemisphere, and the whole objective is for us to build capacity within this region to make sure that everyone, regardless of your social, economical standing, you can receive the best, not just healthcare, but the best healthcare afforded to you.
Now, let me ask, what is the most practical question in this scenario? Every person who requires specialized services that's not accessible in Belize is referred out of the country. What makes Health City the better option, especially taking into consideration the travel costs that will be involved? If people have to go through the United States, they have to get a visa, versus simply going into Mexico or Guatemala, which has been the typical recommendation that people would get.
Sure.
So what is the cost benefit that we're talking about?
No, it's fine. You can chime in. So the thing is that it's not just the U.S. We have 2 direct flights one out of Rotan that goes directly twice a week. We have one out of La Ceiba in Honduras that goes twice a week. Okay. We are looking at actually starting back, because there used to be direct flights from Belize to the Cayman Islands before, and we're looking to do that again. The cost factor is a huge variant in terms of what can happen. And the facilities that you mentioned in Mexico and Guatemala, they're fantastic facilities as well. But there's still some things that are not able to do that's not offered. So when you look at the number of surgeries or doctors at Health City have, the specialty care that they provide, and the cost factor of what we're offering, which is very competitive to the places that you would primarily have been seeing, we are very competitive. So that's sort of, so accessibility wise, for direct flights for air ambulances, we're an hour and a couple minutes away by air ambulance. It's a hop, skip, and jump across the pond, as I like to say. And you know, the doctor that was on talking about national health insurance, and so, you know, doctors from Cuba, from Belize, Guatemala, Mexico, all of our doctors are English speaking. All of our staff are English speaking. So we are an English speaking country. With the Cayman Islands, if you know, is one of the most expensive countries in the world to live, if not the most expensive right now. But outside of having that high level of standard for everything within country, we're still keeping healthcare costs at a low level. So you know, when you come to the Cayman Islands, you're experiencing a high quality of life. You're getting the best of the best in terms of medical assistance. You're getting the best medication, the best implants, and at a fraction of the cost. So it's that's our objective, is to try to show the region, try to show the world that you do not have to sacrifice quality of care by maximizing prices. We are actually doing the reverse. Our directors have been given a mandate by Dr. Shetty that within the next 5 years, he wants to see our costs go down by half. So whereas most countries and doctors are increasing prices yearly as cost of living goes up, our model is to do the reverse, is to put prices down. One of the things that we do at Health City is that we provide what's called bundle pricing. So we could have told Mr. Ried what his cost of surgery was going to be prior to him arriving, and that cost does not change. That cost includes everything for the prosthetic, for the surgeon, for the anesthesiologist, for the meals that he'll be receiving, for physiotherapy, for the room that he's staying in. Everything is included in that cost. So there's no out-of-pocket expense. There's no second or third bill that's going to come to you to surprise you. You know exactly what you're going to be paying for that surgery prior to arriving. As Tanya mentioned, you have a Skype consult with that surgeon that's going to treat you before you even get there. So how many times did you speak?
Let me hear your, I mean, we know your struggles with RA and how there will be continuous complications that will come. And the reason I talk about cost benefit is simply because while experience is extremely important, in fact, in other parts of the world, one of the questions you'll ask your surgeon is how many surgeries have you've done. In Belize, we'll ask what the cost is. That's the fundamentals for us. So G-Mike, when you look at it and you see you were first given the opportunity to be able to access the healthcare, do you think that this will be a viable option for Belizeans in terms of cost?
Well, I would hope so. And again, in addition to that, though, remember I told you that I had the surgery in Merida, which went bad. So Merida happens to be one of the places that many people go to for specialized treatment. This could not be done in Belize, I was told by Dr. Smith, because it was a replacement that went bad. So it required modern prosthesis, and I was told from the very start that it would be very expensive. Now I did get a lot of help along the way. I got a break from the hospital, let me say that. But there are people who also helped me. When I got to Cayman, I was met by a Belizean association there. There's quite a sizable association in Cayman, actually. I was put up by Mr. and Mrs. Katcher, two wonderful gentlemen. This Mr. Katcher is one of the guys who went to Belize as a police officer that was seconded over there. You know, there was a time when they were sending police to Cayman. So I was blessed in that way. Then the hospital, of course, gave me a break. I'll have to say that. And indeed, the service was impeccable. I mean, the facility was clean, and I could not complain at all. The food, I mean, I've been to KHMH. I don't know if you have, but it's like it was coming. It's going gourmet style food, and if I was hungry halfway in between, I'd get a snack. So it was amazing.
Yeah, you're fully impressed by the
totally impressed. Totally impressed.
And Tanya, I know this is obviously part of what you have to discuss with the doctors when they make their recommendations or when you're talking about Health City. How have they seen it so far? And it's scary to think your experience in Merida, because we know how many Belizeans access specialized care in these countries, and really because it's their only option.
Correct. Well, we have been, the response we've gotten from doctors have been a little Slightly skeptical at the start because, it's something very new.
Yeah.
But we have really been welcomed by the majority of doctors with open arms, always looking for a way to improve healthcare. Dr. Koyi at KHMH specifically, this afternoon, we're meeting with the heads of Western Regional Hospital in order for them to really understand what it is that Health City does. It's difficult that somebody just comes in and says, well, we can do this and we can do that, but really we want to show them rather than just tell them we're inviting the doctors to Health City. We want them to see it firsthand, and we're starting to see referrals now. Dr. Smith has been one that has been really helpful in sending patients our way, orthopedic patients, and we continue to access new patients and new conditions that we can service at Health City.
I have another really practical part of accessing healthcare services. My mom got sick a couple years ago, and she was in the States for a period of 7 months. And my dad was there with her, and I think, she has said that him being there was a huge part of why she felt she was able to get through that situation. When it comes to traveling with family or even
I'm glad you brought that up. We actually allow a family member to come with you and stay in the room with you for the duration of your visit there, and that is included in that package cost. The only thing additional is the meals that person would have. Typically we include in the cost the meals for the patient, but just the meals. So we actually have in every room a pull-out couch that turns into a bed, and your family member, and we believe in that, because the thing is when you come back home, your family member becomes your primary caregiver. Yeah. So we actually have a program where we allow and have that family member follow and monitor all the progress, all of the bandage, wound changes, etc. The nurses are educating them as to what they would need to do when they come back home. And again, we liaise with the physicians locally. We keep constant communication. And when you leave our facility, you leave with all of your medical records, all of your physiotherapy that I hope Mr. Ried is following. He had a package when he was released with everything that had been done, all of the imagery, everything. And he is able to share that. We're able to share that with his physician locally. Dr. Smith can go. So if he ever needs anything, again, you're not missing anything. So we do. Right. We do provide that.
I need to say also too that I've had excellent support from the hospital, because the doctor himself has been emailing me and talking to me on a regular basis, staying up to date as to what is happening, asking me what is happening. I had to get some x-rays done, sent up to him so he could review. So the whole package is something that I would recommend fully.
Okay, so let's talk about the list of services that you are offering.
Sure. So cardiac care, in the full gamut, cardiac surgery, orthopedics. We are one of the only facilities within the region that has computer navigation for orthopedics, so more precision cuts and everything. We're actually doing the same thing for our neuro team as well. We're doing a full neuro center, and we're going to have computer navigation for the neurology and spine surgeries. We are doing intervention neurology, which, like I mentioned, for stroke and stuff like that. We have pulmonology. We have oncology with chemo and surgical, but we don't have yet radiation. But that's in our second phase. So within a year, we should have the full radiation center as well. And the need grows. When we see things growing within the region, we do that. We have GI bariatrics. What else do we have? GI bariatric. So we have specialty in pediatric for endocrinology as well as in cardiac care. So we have a pediatric cardiac and EP surgeon as well. And then we have the primary care things such as gynecology, dentistry, and the likes, because those are supporting things that you need for clearance to have those those surgeries done. We have a full lab that's there. So the facility is pretty well established. We can do all the things, MRIs. We have a gamma cam, which is a sort of nuclear imaging. It's the only one in the region as well. And we have HIFU, which is sort of urology. So our urologist gets on island this week, and we're doing the inventor for HIFU, Dr. George Suarez, is teaming up with us, and he's the one that's going to be doing the prostate screenings, and that's again a lot of minimum invasive procedures. Caribbean has a lot of Jehovah Witness persons who don't believe in blood transfusions. So a lot of the surgeries that we do are bloodless, and we're able to do like major surgeries without, without having to do that. So we get a lot of specialty care, a lot of people that have special needs coming to us for those types of things.
And as it relates to accepting payment, is it that you have to pay out of pocket, or if you have insurance, does that apply? How does that work? Or payment plan?
We do all of it. Typically, what we do is the insurance companies, we have approached insurance companies locally as well. We work with a lot of national health insurance. Again, it comes right back to your previous guest. We work with a lot of governments that do national health insurance. So we work with the local insurance companies. We work with the national health insurance with the government. Once we get a guarantee to say that they will cover the cost or whatever the percentage breakdown is, we will honor that, and then they can pay us after, and the patient will pay whatever balance out of pocket. We do have patients that would pay, in some instances, pay out of pocket and get reimbursed by their companies. We have a lot of people, when their insurance companies are not, especially in the Cayman Islands, being there, we have a lot of people that walk into a facility and pay out of pocket because their insurance would say, oh no, you have to go to the government facility, and they're like, yeah, forget that. They're going to walk right in and pay out of pocket because of the quality of care and the level of treatment that they're going to receive. They know that they have, the specialty services available there.
Now, and Tanya, as the agent in Belize, where do people find you guys, or how do they get more information if they're interested in accessing one of the services?
Well, firstly, we have a website up at interchangehealth.com, which has a lot of information. If somebody just wants to read up about it and they're not really sure if they want to make a call, they can contact us directly through the website.
Okay.
If not, they can reach us at our office at 223-1025, and somebody will direct them immediately to either myself or to Whitney.
All right.
And all of our services are actually online as well, so I'm sure you can get that on the InterChange site, as well as all of the statistics on our surgeons are there as well, so people can follow up.
They can
and
do
see.
their
There's a lot of
research.
information online. Yes.
I know the conversation is primarily around what Health
Yeah.
City and the care that they provide, but it would be remiss of me to not thank the many people who were helpful in getting me over there and getting that attention. No? First of all, of course, the hospital, and then there were quite a few people at home and abroad that assisted in me getting there and getting back.
Yeah.
So I have to say thank you to all those folks.
And how are you doing after your surgery?
It's coming along. It was a major surgery, of course. It was a 10-hour surgery. So
So it was removing the replacement that was in.
yeah, doctor had to
changing.
cut the entire bone actually and remove all the old cement that they used because it was the rudimentary type that was put in Merida. So they had to take all that out, and it was a major surgery. Interestingly enough, it happened on November the 8th, which was election day in the U.S. So, of course, the first question I asked when I woke up was, who won? And the rest is, But
we missed your insight during that time. Don't worry. But
Yeah,
now
right.
we understand
Right,
why.
right,
So
right.
you're doing better.
yeah, much better. Yeah.
Okay. Well, it's good to know, and we appreciate you coming in and sharing your personal experience.
Thanks for the
and
opportunity.
for both of you for coming in and sharing what is now available to Belizeans through Health City. All right?
Thank you for having us.
Okay, we're going to go ahead now and take that final break. When we come back, we'll have our wrap up, so stay tuned.